Go to the keynote address, the wish list of Indian doctors. I now request Dr. Shashank Joshi, President, API and Consultant Diabetologist, to please come on stage. Padma Shri Dr. Shashank Joshi is probably the youngest physician in the country to have excelled in endocrinology and diabetology. Dr. Joshi is the darling of Indian medical doctors as well as the seniors in the medical professionals. Dr. Shashank is also the president of the Association of Physicians of India, and Dr. Shashank Joshi is often called the Google of Indian medical dictionary. He remembers all the pages concerning the critical analysis of medical abbreviations. Dr. Joshi is the shining star of the Indian medical profession. Over to you, Dr. Shashank Joshi, for the keynote address.
Thank you for your kind words of introduction. It's always a pleasure. I'm actually here only because of one man, because this show is a one-man army. And it's Satya Brahma. And I've known him probably one of the longest in this whole auditorium. I think I've known him from 1991. Ajit knows him since 1999. And I've had a very fond fortune to see him groom from an activist journalist. And I think he's still the same. And that time I used to be leading strikes of, for residency programs at Grand Medical College when we were in resident doctors. And Satya used to be a very active journalist then. And I think we have gone a long way since then. So Satya, thanks for getting me back here. And he insisted that you must talk on wish list of Indian doctors. I said, I am a complete outfit to talk here because I am talking in midst of all entrepreneurs and all big doctors and all big industrialists. And I am a daily wage earner. I said, why are you making a daily wage earner like me, bunk my daily wages because I have to see patients every day in the evening. If I don't see them, I don't get my daily wages. And why do you want me to come and be here? So Satya said, you don't have a choice. You have to be here. And because I am also happen to be the president of the Association of Physicians of India. And this week, we are celebrating Physicians Week. And we had a Physicians Day. And we had a theme that we want to go out to all parts of the community at large, to healthcare professionals, to pharmaceutical people. And I am told most of the people here are of pharmaceutical origin, though I was very delighted to see my good friend Dr. Anjali speaking a lot of things which I completely agree with her. And we often follow each other in various fora. And we, I think, often meet at such fora. So she gave a wonderful presentation. And my health educational component of my talk she has already done, And that is very nice to see that. So I think having said that, I think what is a wish list of an Indian doctor? What is it that a doctor is looking for? So when you look at the word doctor, and if you look at the Latin translation and the archival translations of the dictionary meaning, because, Brahma put me as a Google medical dictionary. I wish I was one. Okay, he has given publicity to Google. Okay, but I think we are all here to educate. Doctors are nothing but educators because they are connectors. It's like yoga. The word yoga means to connect, to unite. And similarly, the word doctor also means to educate because we are all here for a very simple task. We are all taking an Hippocratic oath, and we are all imbibed to our oath that we are here to serve people and recognize their problems, identify their challenges, and see what best we can do to educate our patients so that they can be better in terms of their disease profile, risk factor profile, and see what best we can do, how to make their quality of life better, how they can be smiling with their diseases happily. I think that is one of the primary wish lists of any doctor. I like to see every day when I see a patient who goes back smiling, who goes back comforted, who goes back feeling happy. The doctor said, there's nothing to worry, no? And that is so important. That compassion is so important. That power of healing, which actually is only with God. And we have been having that status for some time. And that's so important. But unfortunately, our medical education is a very long drawn process. I see every day in newspapers, and of course newspapers in the English medium have all become commercial entities now. We hardly find true news. They are all for consumers. If you look at the regional media today, they are all for politicians to garner their votes. So it's very difficult to find true news. But in that little true news, you see, an IIT graduate, if any graduate, he gets a big fat packet of salary, and then an MBA gets another packet of salary. And when a poor MBBS doctor is there, he's not very proud that he's an MBBS doctor. We are daily wage earners. I don't think Shilpa would have married me just if I was MBBS. She wanted to have a qualified husband, so she just arrived here, and she thought that at least need to have an MD. So 5.5 years, first 4.5 years we spent doing MBBS. Then another 1 year we do internship. Another 3 years we do MD. After that again we have to struggle and do another 3 years of DM. And then of course nobody likes to have only Indian degrees. Though of course we fortunately have a very patriotic Prime Minister who wants to have a Made in India campaign. And I wish that they recognize our Indian degrees abroad. They still are recognizing it. And then we go abroad, we try to train and get some information from abroad, get those degrees attached to us, come back. So by the time we are doing that, we are around 35, 40. And we are setting up our practices. So it's important to rewrite. One of the wish lists doctors have is to rewrite the medical curriculum to make it more user-friendly and also make it more adaptable to the current environment. We are still following a medical curriculum which is predominantly from the British legacy. I come from Grand Medical College. It's the second oldest medical school in India after the Calcutta Medical School. There's just a 1 year's difference between, and I was in Calcutta last week speaking on API forum again, and I can tell you and assure you that we have not changed our curriculum to a great extent, and we need to rewrite our curriculum, make it maybe in 4 years, then do more didactic training, because the number of patients we see are far more than any doctors in any part of planet Earth. Maybe only China competes with us only because of population, but I think we see much more patients and we are able to give much more better quality of care because we are surely doing pattern recognition. And we learn surely by experience in India. On an average, an Indian doctor sees 150 to 300 patients a day in each part of India. Compared to that, a European or a US model will see around maybe 8 or 10 patients. Also remember that most of the laws which we are now trying to adhere in India related to pharmaceuticals, healthcare professionals, ethics, they are all linked to a reimbursed environment in Europe and USA. So we have picked up laws from there, we have tried to adapt it to India, and therefore we are having this difference. Now we all know that India is a welfare state, and when you have a welfare state, it is the duty of the constitution to provide everybody free medicines. Now it is not possible to provide everybody free medicines, but we also are a free trade economy, we are a developing country, so we will have one medicine which will be sold at 50 paise, and the same medicine may be sold by the innovator at 10 rupees, and by a lot of generic manufacturers maybe at 3 or 4 rupees. And therefore, there is a choice with the patient and with the doctor. However, we are scrutinized by our Hippocratic Oath, which is self-regulatory, our own code of conduct by the Medical Council of India, and now, of course, there is a new voluntary uniform code of conduct for the pharmaceutical industry. So we are viewed with suspicion from every side, whether it is the doctor or whether it is the industry. And if we both come together, and I was in Lilavati Hospital today morning practicing, and I said today evening, I have to go for a symposium where there are pharma leaders. So, doctors, you people are always sitting and having dinners in 5-star properties with all these healthcare industries. So this is always looked with suspicion. Okay, though there's a big Lakshman Rekha between the two which exists, but still it is looked with suspicion. And that is a wish list of a doctor that I wish people don't scrutinize us so much. Okay, there are so many other businesses which are occurring. If you buy a German car in India, it is 20 times the cost that what the same Audi or a BMW or Mercedes will cost you in Germany. It is that, but here if you give them an innovator medicine or a medicine which is little expensive, everybody will look at you with suspicion. They will ask you which trip you went, where you went, how you went, okay, who gave you this. So, because drug and medicine is an emotive purchase, emotions are involved in it. And because emotions are involved with it, we sometimes forget practical reality. So I think one of the important wish lists of a doctor is we need to adhere to our Hippocratic oath. We need to have a very healthy relationship with the industry with a Lakshman Rekha which is clearly drawn. And I think if we are able to do that, because ethics is self-regulatory, we have to regulate our ethics as medical doctors, and industry has to regulate their ethics, and they need to maintain a healthy relationship. As long as that relationship is maintained, I think we can go a long way. And I think that is what probably the things are important to do. Unfortunately, media and Brahma, Satya belongs to the fourth estate. Okay, they are always looking at us with a perception challenge. They are looking at it in a very different perception. They are looking at us with a skepticism and with a doubt. So we need to clear that. So we need to reform medical education in a big way. We need to make it more user-friendly. We need to make it very Americanized, more westernized, and also Indianized to a great extent. We still learn diseases which are there in the Western world. And this year, one of my themes at API was to generate Indian evidence. I traveled each part of India. And there is so much of Indian evidence and Indian diseases which are still prevalent within our own country that we need to generate Indian evidence. You saw Professor Mohan speaking very elegantly. And he spoke on the Indian evidence of diabetes. He's a very good friend of mine. We investigate so many issues together. And clearly we need to recognize that we need to generate Indian evidence. We eat different food. We had many presentations on Ayurveda, food. We eat different foods. Okay, we are thin fat Indians. We talk too much. Our brain has too much of glucose. We also have too much of diabetes. There's that, I told Brahma, what is wrong with you today? I am only seeing diabetes all over, written over directly or indirectly. Okay, have you become a diabetic? He said, no, I am very lean and thin like you. Okay, so remember that it's important to recognize that we need to change the way we are living. And doctors need to look after their own lifestyle. So one of the wish lists for doctors is, I wish they are able to follow what Anjali told. Okay, that sleep by 11 o'clock. Okay, sleep for 7 to 8 hours. Okay, and then it is the onus is on the patients because they can't disturb them. Okay, but I hope one of the wish lists is that we get more and more partnerships in practice. Just like they have group practice in the US or in the Europe, we need to recognize that 80% of medical care in India today is in private sector. Unfortunately, because it is in private sector and it is self-paid because there is no third party paying for it, okay, there is a lot of commercialization. And because of that commercialization, okay, though they are doing extraordinary quality of care, even in the best tertiary care hospitals, we just saw a beautiful presentation on cancer, on bone marrow transplant. I am sure the bone marrow transplant or any procedure you do in India is at least 1/10 the cost or 1/20th the cost in the US or Europe, and probably done by better skilled surgeons. So I think we have the best of both worlds. We are a changing economy, we are developing very rapidly, but we need to ensure that the medical profession and the healthcare industry need to work in partnership, change their public perception, and change their image so that they are recognized better by overall people at large in a better perspective. The current government wants to make affordable healthcare for all, and it is very right, because at least a good 30 to 40% of Indians are poorest of poor in India, and they have no access to any sort of healthcare. When they say that, at the same breath, you must have read today's and yesterday's newspaper that they have cut down 6,000 crores from the healthcare budget, which probably is appropriate because I think they have applied their logic. They have realized that some of the schemes which were giving therapies long-term or lifelong for patients may not be the right thing to do, but I think rather than cutting costs, we are only spending less than 1% of our expenditure, of our economy, of our GDP into health. China spends 3%, US spends 8%. Even if we spend 1.5% or 2% of our GDP in health, our health will improve. And if health will improve, automatically there will be economic transition. Because what is the challenge which has occurred now in India? There's a dual challenge. We have this big problem of environment in rural and urban India. We also have the big climate change which is occurring and affecting the diseases of air, pollution, and respiratory diseases. The